Hi, everyone. I'm Michelle Cowles, Director of Business Development at Rogers Behavioral Health. We're so glad you could join us today for our Facebook Live Q&A on parenting during COVID-19. Today we have with us Rogers Dr. Peggy Scallon, Medical Director for our Focused Depression Recovery Adolescent Center Residential Care, who will be answering questions that are on the minds of parents right now. Please feel free to comment with questions and we'll do our best to answer them at the end.
Thank you, Michelle. I'm happy to be here to discuss this important topic that's affecting all of us. The COVID-19 pandemic has been worldwide and dramatic, leading to circumstances unlike any other in our lifetimes. If we think back to the beginning of 2020, when we all started hearing about coronavirus, I don't think any of us would have anticipated the way our lives would look right now, and we're unsure when it will end. So the loss of life, illness, and suffering has been real and profound. And in addition to that, businesses, schools, sporting seasons, entertainment, social, and family gatherings have been closed and canceled. And our routines and our roles have changed. Some people are working from home, and many people are worried about money, in addition to worrying about getting sick. And especially now, we're concerned about the return of the school year and how kids and parents will navigate this. So today we're going to talk about the impact of COVID-19 on parenting and the mental health of both kids and parents.
Thank you, Dr. Scallon. It is overwhelming, and we'll just get started on some questions. I know that there are many. So many parents are feeling overwhelmed with the unknowns that the pandemic continues to bring, especially with the new school year starting. How can parents ensure they keep their own mental health in a good place so they can be a supportive resource for their child's mental health?
Boy, yeah, parents have a lot on their plate at this time. If they can work from home, they have a new work reality with Zoom calls, less support, and contact with colleagues. All of their former routines are gone. But at the same time, they're needing to serve as their child's teacher and do it all without childcare. So parents really have the trifecta of being an employee, parent, and teacher all at the same time. I think that's staggering. I think it's incredible. And I do want to congratulate parents who are doing this and commend them because it can't be easy. My own two children are 25 and 20 now, so I haven't had to manage this, but I've seen friends and relatives and coworkers try to adapt to this new world. And each family has a different circumstance. Single parents do it on their own. Married parents may tag team it, trading off work and caring for the kids, and many need to complete work after kids go to bed at night. And then there are essential workers, frontline workers who can't work from home. They may have stressful jobs and also have the worry about contracting COVID in their workplace. And they're trying to arrange care for their children while they work, and childcare is much more limited now. So, Michelle, one thing we know about youth is they are watching the adults around them as a guide and a model for how to respond to situations. And kids likely know that their parents are stressed right now. But if they see adults maintaining balance, self-care, and trying to stay positive, children will have an easier time following suit with that. Kids do best when they see their parents maintaining control and working through problems. And parents can be honest about the situation at hand and acknowledge that it's difficult, and also not provide false reassurance about things that are out of their control. But they also should try not to burden kids with their own anxieties or sometimes their worst fears. Kids can really absorb that and feel it deeply. And parents should try to remember to seek out their own adult supports and remember not to burden kids, because kids can't control those worries and they end up feeling overwhelmed, and they can start to be more depressed and anxious. So parents can stay healthier by maintaining structure and routine. You'll hear that a lot in thinking about how to parent during this time. So this means keeping predictable sleep hours, maintaining good nutrition, getting regular exercise, getting outside. Parents should seek out safe opportunities to socialize, whether that's virtual or via phone or outdoor safe activities, and keep a balance of productivity and rest. But we know that staying active and staying connected to other people and getting support from other people, especially those who may be going through the same things that you're going through, can definitely decrease isolation, enhance problem solving, and decrease anxiety and help to improve mood.
That's wonderful advice. Is there anything parents should stay away from doing that may hinder their child's mental health during this uncertain time?
Yeah, well, parents are worried about their kids. They see their kids being less social, less active, less academically engaged, and they worry about their future. So these anxieties are only intensifying as we near the end of summer vacation and the return of the school year. We worry if kids go back to school, and we worry if kids don't go back to school. So parents should maintain positivity about their current school plan, talk about how their family is going to optimize safety, find a plan they're most comfortable with, whether it's online or in person. And after they do that, then try to generate enthusiasm and a positive outlook so the kids can feel good about that plan too. And then parents should convey interest and support for their child's academic assignments, setting up a space in the home which is quiet and appropriate for homework and study as much as possible. They should try to be in regular contact with their teacher and school and maintain regular conversations with them, and sometimes share those with kids so kids get a sense that there are a lot of adults on their team. And parents should strive to provide regular meals, regular sleep and wake times, and of course, monitor time limits and usage of screens. So having a routine helps kids thrive. And if kids really are feeling hopeless and helpless, perhaps they can flip those feelings around, because we know that kids do well when they can do something positive. They like to feel that they are part of the solution or they're helping others. Kids feel worse when they feel helpless or that they are a burden. And so kids and all of us do well when we're helping. Taking agency, doing good greatly helps mood. So for kids, this might take the form of writing letters to people in nursing homes or care centers, or doing something nice for elderly neighbors, such as yard work, or making a meal for the family or for other people.
That's so insightful, very helpful. What are some signs that a child may need more than parent support and that they should seek professional help?
Yeah, so we've talked a lot about the difficulties that are part of the COVID-19 pandemic, and there's no doubt that this is a time of high anxiety and depression. And so it can make it hard to distinguish what is a more typical response to that versus when it's time to seek help. And so I do want to emphasize that if you or your child experience hopelessness or inability to function or social isolation or suicidal thoughts, it's definitely time to seek professional help. This can start with their primary care doctor's office. They can help determine the level of care needed. And there is a whole continuum of mental health care available, ranging from outpatient support and up to and including day treatment, inpatient or residential services at a place like Rogers.
Okay, wonderful. We're glad that you're here. I just want to remind everyone listening, if they have any questions, just put them in the comment area. And thank you for such insightful guidance, Dr. Scallon. Let's check to see if there's any questions that may have come in. I see that there is a question in queue, and I'm going to look over in another screen here to read it, but it says, how can educators partner with parents to support their child's mental health?
Yeah, well, more than ever, it's important for parents and schools to have open communication with each other. There is a bigger gap and they're not rubbing shoulders in the building. And so it requires extra effort to reach out. But maintaining that open communication with school staff is really important. Teachers have anxiety about returning to school, and administrators, parents also have anxieties, and so do kids. And so at that time, it's just more important than ever to come together about the shared goals. And for parents, they can find out what resources are available through the school and just keep asking questions, and also to convey a positive tone toward the school, because kids really pick up on the feeling that, you know, all the adults in their lives are working together in their best interest.
Thank you. The next question is, you mentioned to limit screen time. What about when kids' school is going to involve 6 hours of virtual education?
That's exactly it. I mean, parents are used to limiting screen time. Often they'll limit the number of hours, but all of those things are now different because kids are getting their academics on screens and their socialization on screens. And so some of those old rules really can't apply as much. There's no substitute for supervision, you know, having the kids keep their screens open where parents are working, and for parents to be aware of the apps that they're using. There are, you know, certainly homework kind of sites, and then there are other more problematic apps that kids can find and get into. And so it's important at this time, more so than the time content, because some of that is out of our control, but to be more focused on the content of what the kids are working on. So there's good that can come with screen time too. You know, we know that kids can be in touch with friends that way, or extended family. And so, you know, there's good that comes with screen time, and like anything with parenting, it's that good balance, and then also individualizing it for their child and supervising.
Thank you. Let's see, we have a comment. I've tried all these suggestions for my second grader and nothing seems to be working. Any tips? And I will add someone else's question, that these suggestions help their 14-year-old daughter keep afloat, but 17-year-old son with very high functioning autism and DMDD is struggling. I feel hopeless and out of resources for him. Is there any tips that you can give us for these areas?
Yeah, well, it's so true that every child is different depending on their age and their personality and their unique circumstances. And so it's true that one child in a family might be able to kind of navigate some of these things without, you know, any difficulty. And you know, other kids might be overwhelmed or flooded. And so, you know, what we try to emphasize is that all feelings are okay. Some kids, you know, do well and others are more burdened. But, you know, what's most important is that we let them know that we can be a resource to them and we validate their feelings. You know, as parents, we're trying to stay aware of what they're going through, and you know, talk about the range of feelings, and to let them know that we can also get more support, you know, if needed, if it's not enough.
Yeah, thank you. And at the end, we'll add some resources or places to call if you're feeling you need a little more answer to your question. Let's see, the next question is, as the school year begins, or I'm sorry, I've tried all these situations for my child and nothing seems to be working. One of my children's handling of the unknowns of COVID-19, and my other is struggling. I'm not sure I quite understand, but I think maybe talking to what they're saying is talking to a child who has a fear of the unknown and the what ifs and how you walk them through that when you're having the same fear yourself.
Yeah. Well, usually when we deal with kids' anxieties, we try to listen to what they're going through and not make assumptions about what we think they might be going through and validate their feelings and to, along with that, be able to think through with them coping strategies that we could use. And usually with anxiety, it sort of starts out with some amount of pushing through that and then also not flooding kids with anxiety, and so they can talk about ways that they can cope and feel strengthened, and then build upon that toward a little more challenging activities. And for parents, once again, to try to remember what they convey to the kids is most important. It's helpful to look for the humor in this. I know that maybe there's a risk in sounding insensitive to that because of so much suffering and death and illness and worry that comes along with the COVID-19 pandemic. And at the same time, to try to look for the silver linings. Many families are finding that their calendars have slowed down and they are able to spend more time together as other activities are canceled. And this can allow time for new experiences. So they may, delight in some new things they didn't know that they enjoyed doing together around the household, or even, local exploration within safe boundaries. And so, but just to be aware also that this time will end. Normal activities will resume. We hope that it's sooner rather than later, and it's very difficult when we don't know when that end will be. But even though this is dragging out, it's an impermanent situation, it's temporary. And so trying to keep that in mind and to emphasize that to kids, that's the most important thing. Kids don't have life perspective. They haven't, lived for decades, and all of these things are new to them, and they may wonder, are things going to go back to normal? But if we remind them that, there have been hard times before in this country, and we've weathered through it, and to remind them that we are tough and resilient and strong, and we stick together and support each other during that time and stay positive, then kids really do feel good about that. They may not show that those words are helpful in the moment. And, it might feel like, oh gosh, I'm not sure if I said the right thing, but they hear it, and they store it, and they also convey our own affect or sort of emotional tone around those things. And so, again, trying to look for those silver linings, trying to enhance connection, and, to recognize that this is impermanent.
Yeah, and I think there are some positives being closer as a family. And I'm wondering, I have a kindergartner and a high schooler, and we've been home since March, and we've been together a lot, and it's become our new normal. For the 5-year-old, is there going to be anxiety about leaving and as he starts school here in a few weeks, when he's used to the structure and he's the prince at our house. So when he goes to school, he's back to sharing, he's back to normal activities.
Yeah. Yeah, that is really true, Michelle. I mean, thinking about the re-entry when we're on the other side of this is a whole new domain altogether, and it'll be something we haven't done before. But as you say, yeah, for a 5-year-old, 6 months is, almost an eternity. And so the thought of then having to kind of go back out and get in a routine again is really something. Like I said, my children are 20 and 25, and they have needed to worry about, will their classes be online or in person, and their friends are wondering if they should take a gap year because, is the quality of the instruction going to be the same? And so, at every level of development, we are facing unique circumstances. And elderly people face different kinds of circumstances. They may be aware that they're at higher risk if they do contract COVID. And, at the same time, they may feel that time is finite, and they, are just really stuck in a dilemma on some of those things. So, validating that all responses are okay, and, we can share these and be supportive to each other, I think is the most important thing.
Okay. I know there was a question that came up about children's books. Are there children's books that could help kids cope?
Oh boy. Yeah, there are children's books that depending on the developmental stage of a child, there are numbers of them. There's for younger kids, Taming Your Dragons is always a good resource for little kids, and there's a whole variety of manuals that deal with anxiety and mood in older kids, and perhaps that's a link that we could put on at the end. We could reference some of those just to make sure that we get those details right.
Yeah, that would be wonderful.
Yeah.
Let's see, another question that's coming in. Are there certain questions parents should be asking their pediatrician as we're getting ready to go back to school about mental health during their well checks?
Yeah. Well, of course, right. It's important for kids to maintain their regular health routines and stay current with things like immunizations and well child checks, and to stay in close touch with their primary care office. Pediatricians are out there still working, and while COVID is one element of their practice, it's super important to, maintain regular health in all other ways. Kids have acute and chronic illnesses, and so all of those need to be managed. And pediatricians' offices, family practice offices, are very much used to being a resource for, families. They can help with sorting out mental health concerns, as well as, the other medical issues that can arise. So absolutely, it's important to be in touch with them.
Absolutely. And I see there's a lot of questions about, or comments about people who have children who they feel need a higher level of care. And I just wanted to put our contact information out there for the healthcare like Rogers has to offer. And I'm going to give you a phone number, and we can also put this in the links. Rogers' phone number is 1-800-767-4411, 1-800-767-4411. And then your local NAMI chapters or Mental Health America resources could be a support as well. And we'll add those into the links. And I'll go on with the next question. Would you?
Oh, go ahead. I just jump on with that, Michelle. Yeah, so I would like to just emphasize that as well. We have a really great service, which is that we offer free confidential screenings for parents or adults who are concerned about needing more mental health resources. Mm-hmm. And so they, take a history and understand what the symptoms are, and they can help sort out what level of care is needed. And we can, find somewhere on that continuum of care that would be appropriate. And it might not be Rogers, and sometimes that's part of the feedback. But understanding there is a continuum of treatment ranging from outpatient therapy and supports, which may be with primary care, it may be with a mental health practitioner, or it can be inpatient, day treatment, residential services. So there is just that whole range, and so that's one thing for parents to be aware of.
Okay, wonderful. And another question was, what would you recommend for parents of college-age students who may be depressed about not returning to campus?
Oh boy. Yeah. So that one is important because one thing we know about college kids is that their socialization is really important to them. They are about thinking about the next steps as they launch into adulthood. And so, they have a range of opportunities available to them. Sometimes kids will choose to take a year off school. Sometimes they will go back to school. Sometimes there's a hybrid model. And, as part of the process of parenting young adults or older adolescents, they they're developing their own autonomy. And so they are thinking through the circumstances, but they also really like a sounding board. And so if we are able to be a resource to them to listen without judgment, without our own agenda or preconceived ideas about that, and help scaffold their own thought process and help them organize the pros and cons, and then develop with them a list of options and then think them through, kids can feel really supported by that. It's not that we're solving their problems for them or that we can, but boy, is it nice as a young adult to have adults in their lives who can scaffold those processes. So being that adult resource is really helpful, or pointing them in that direction and helping them to think through the pros and cons of their choices, I think, is really important. Yeah, and I feel for the kid, for all the kids. They all experience it in different ways, and it seems that especially some of those kids that have missed some of those milestones, the high school graduation and the launch to college, or any of those transition times, which are really big. To honor with them, like, that's a loss, and you can feel your feelings, and that's okay, and it makes sense.
That's so insightful. And I think that this conversation has brought a lot forward, and we probably still have more questions. I think one of the realizations that I'm having is that the children are there, and they see us, and they are worried as well as we navigate through all of these changes.
Yeah.
So I just want to thank you, Dr. Scallon, for your time. Yeah, it was so nice, and thanks for so much for joining us, to our audience and sending the questions. We hope that it was helpful. And if we didn't get to your questions, or you have additional questions and comments on the topic we discussed today, please direct message us on Facebook. And for more information on the services that Rogers provides, visit rogersbh.org for helpful resources like videos and blogs and a variety of topics. So it's rogersbh.org/resources. Thank you again, Dr. Scallon, and thank you for...
Thank you, Michelle. Yeah, it was great talking to you. So I really appreciate that opportunity. And, above all, if we can come together and support each other during this time, that is the most important thing. So thanks so much.
Thank you. So helpful. Stay well.
Yep. Bye-bye.
Bye-bye.